Today we are taking a look at teen pregnancy. Erica Quednow is digging deeper into that for us this morning. And Erica, a central Illinois town is seeing rates go down when it comes to teen pregnancy.
Yes, Cynthia, Macon County health experts say their community's health is improving. The percentage of teen births has dropped in recent years. It's gone down for girls 19 years old and younger from 17% in 2007 to 9% in 2014. The Macon County Teen Health Coalition met during Teen Pregnancy Prevention Week a little earlier this month to share the findings. Still, they aren't sure which efforts have paid off the most to get that number on the decline.
We're happy for the outcome, whatever the cause, and we'll continue to work providing education, access to health care, and other services that young people need.
Now here's a look at those numbers from the Illinois Department of Public Health. In 2014, teens 19 and under in Macon County gave birth to 142 babies. Back in 2007, that number was 240 births. So that's 98 fewer babies born to teen moms last year. Cynthia.
All right, Erica, and we're digging deeper into those trends this morning. We have Bridget Leahy joining us this morning from Planned Parenthood. And really, we're seeing that mirrored on the national side of things as well, with those trends at historic lows.
Yes, nationwide, as well as in Illinois, we have reached historic lows in teen pregnancy, and that is really great news. Some of the national studies that have been looking at these trends say that there are a few things that contribute to this.
Okay.
One is quality sex education that talks about prevention, including birth control, and the other is increased access to birth control, including increased use of long-acting reversible contraceptives like the IUD and the implant.
When we look at sexual trends in teenagers, is it just that more teenagers are getting better at not getting pregnant, or are fewer teenagers having sex?
It's both, actually. We're seeing a decline in the numbers of teens having sex, delaying having sex, so they're waiting until they're older. And then when they do have sex, they are better at using contraception. In fact, in 2013, a study of Illinois teens, high schoolers who were sexually active, showed that over 80% of them had used contraception the last time they had sex.
And what is contributing to some of those decisions, and why maybe are they delaying sexual activity?
Well, one of the things is quality sex education. In Illinois, we passed a law, and we're very proud of it. Planned Parenthood worked very hard to make sure that every public school in the state of Illinois that teaches sex ed has to teach age-appropriate, medically accurate, and complete information to students. And the information has to include information about prevention of pregnancy and sexually transmitted infections. It's been shown that these types of programs help teens reduce risky behavior, delay sexual activity, and then when they eventually do have sex, they're better at using contraception.
And so when we talk about some of these programs, how is that different than some of the education that they would either get from maybe their friends or parents who wouldn't be held to maybe those exact standards by law?
Well, first of all, if a teen is not getting information from school or parents, they often turn to their friends, and that can be a quagmire of misinformation and rumors and myths about when you shouldn't use contraception, what is effective, what isn't, and that can lead them into making mistakes or irresponsible behavior. So we really do urge teens to seek out reputable sources of information. If they have a teacher they trust, they go to your parents. It may be awkward, but it's okay. And of course, Planned Parenthood is available for information. We have a health center here in Champaign that is happy to counsel and educate a young person. We're teen-friendly and non-judgmental. We have a website, PlannedParenthood.org, that has a special page just for teens that can give them the information they need, and you can even ask a question. You may feel like your question's weird or awkward. Go on and you'll see that lots of other people have asked those questions.
I'm sure you've heard it before. I'm sure you've heard it before. And so there's a special section for teenagers, but as you mentioned, this can be an awkward subject to broach for parents as well. Are there any resources out there for parents who are wondering how to start this conversation, how to have it, and when to have it?
Yes. Planned Parenthood also has a section on our website, PlannedParenthood.org, that is for parents, and it talks about starting the conversation. It also gives a lot of information because you as a parent may not feel like you know all the information. Well, you have a resource out there that you can get the information you need to provide accurate information to your kid. But the most important thing to remember is get the elephant in the room out of the way. It's okay to admit to your son or daughter that you are nervous, that this is awkward. They may feel awkward too. And I also encourage parents to start the conversation young and have it be an ongoing conversation. Don't think you're just going to do the talk once and be done with it. You need to bring it up, you know, when there's a song on the radio or something on TV, and use that as a conversation starter.
And when we look at the statistic we have there, 70% of people have sex by age 19. And so how young do we start this talk?
Well, you know, you should probably start when your child is very young with just using the appropriate and proper words for body parts, talk about personal safety, and then when a child starts reaching puberty, you want to talk about changes in the body and body image and those kinds of things, so that once you get to where your teen might start being interested in dating and that kind of thing, you have the groundwork already laid to have the conversation.
That elephant gets smaller and smaller every time there's a conversation, right, Bridget?
Yes.
All right. Thanks so much for joining us this morning.